So this conversation is important because we are about to celebrate Prostate Cancer Month. Am I right?
Yes, exactly.
Excellent. Okay.
Prostate Cancer
Prostate Cancer
Awareness Month.
Awareness Month. Okay, it's an important month. We all get very concerned during Breast Cancer Awareness Month, and I think we should have the same level of concern for prostate cancer. So thanks for coming in to give us all the education we need about it. Let's maybe start with some definitions. What exactly is this prostate cancer we're talking about?
So the prostate is found in males, and the prostate cancer is a disease of males. And as you age, the cells in the prostate begins to undergo changes such that it multiply beyond its normal limit. And these cells that multiply can cause the gland to be enlarged, or it can spread locally at where it is, or it can spread to distant areas.
So first thing, most important, it happens to men.
Exactly.
Right, and it's when your cells start to grow exponentially, and that creates this cancer, right? Okay. Can any man get this, or are some men more at risk than others?
So some men are at risk than others, because this is a disease that spread in some families. In some families, there are men who have had the prostate cancer, or in some families, they are not only the men but women who have breast cancer, ovarian cancer, or any other cancers. So the germline in that cell is inherited by the men, and this will increase their chances of getting cancer of the prostate.
I see. So really, any sort of family history of cancers can increase a man's chances of getting prostate cancer, right?
Yeah, that's right.
Okay, all right. So we now know men who have family history, these are people who are at risk. Any other risk factors?
The other risk factors for prostate cancer is obesity. Having your body mass index, if it's high, you're at increased risk of getting cancer of the prostate. And also diet. Having diet which is high in fat, this will also increase your risk of getting prostate cancer.
So men with family history who perhaps are overweight. Okay, all right. Are there people from some parts of the world who are more at risk than others, or are we all in the same boat?
Yes, Kojo, that's true. So in addition to that, it's been found out that men of the black race, which is mostly us in Africa, tend to have a rather high risk of developing prostate cancer. And not only that, we tend to even have the more aggressive form of it that can be quite dangerous for us. Right. So men of African descent are also at increased risk of prostate cancer.
Okay. Is it something that is age sensitive?
Indeed, it is also. Prostate cancer tends to be also common as you grow older. So generally, in the Western world, they tend to find prostate cancers in men above 70 to 80 years. But as I said already, we of black race are at increased risk, and so we tend to have our cancers developing earlier. And in Ghana in particular, we see the bulk of our cases between the ages of 60 to about 70, almost a decade younger than in the Western world.
I see. So listen, let's try and measure the size of the problem. How prevalent is prostate cancer in Ghana?
It is prevalent. In a study that was done by Prof. Yeboah, he found out that 6 out of 100, that is 6%.
Wow.
Have prostate cancer.
That's actually a disturbing statistic.
It is, and then from a study that was also done by Professor J. Mensah, he found out that 80% of the men who come to the clinic, they come at a late stage of the disease. And so,
why is that important? What difference does it make at what stage? It's cancer, right? So why does it matter what time I report it?
So because if you come at an early stage of the disease, then we can give you a treatment with a curative intent. It means that we can cure the disease. However, if the disease has spread, it is challenging and difficult to treat it.
So are there things that as a man I can look out for that might tell me that, look, I need to go and get checked?
So that's a very good question. So what we are saying is that men above the age of 40 should be screened, and especially if you have a family history of either your father or your father's brothers having prostate cancer. You come at an earlier age, which is about 5 years earlier, so from the age of about 35 years. And in some men, you don't have any symptoms. You see, so just when you come and we do your PSA, the PSA level is supposed to be from 0 to 4 nanograms per ml. If it's high, it means that your risk of getting the cancer is high. And then there are also other signs and symptoms that we look out for.
So if you have a high PSA, then you are at risk. How do you check it? Is it a blood test, or how do I go and check my PSA?
PSA is a blood test, yes, and then there are other tests that is done to add it up, which is we do what we call a digital rectal examination, where because the prostate is just below the bladder and is very close to the rectum, we put our finger through the rectum to assess the consistency of the prostate, and that will give us an idea if it is normal or if it is not normal.
I can sense men across the country crossing their legs in discomfort.
I really want to reassure them very quickly that it is done when done by a trained finger, which is a medical personnel. It causes very, very little discomfort. Our fingers are well gloved. They are positioned in a very comfortable place. It's done in a room that is warm, on a bed, safe and secure, and would instruct you all through the process. If at any point in time you have any discomfort, it will be stopped. It is not meant to cause any harm. Of course, we are men ourselves, so I should do it as humanely as possible to you, for I may be the next person on the couch to be examined. So rest assured, my colleague men, it is not a procedure to be afraid about.
Yeah. Well, you're listening to the very reassuring doctors from the West Africa College of Surgeons and Kolebu Teaching Hospital. Dr. Awuku Asabreare is a urologist fellow at West African College of Surgeons, and Dr. Bright Wereh is a urology resident at Kolebu Teaching Hospital. Of course, we're talking about prostate cancer. We're learning that 6% of men in Ghana, according to a study, have already been diagnosed, and these are the ones we know of. Goodness alone knows how many are yet to be diagnosed. Now, you mentioned something when you were educating us about the risk factors, Dr. Wereh. You talked about family history.
Yes.
In fact, I think it was Dr. Awuku Asabreare who mentioned it. That when you have a family history, then really from age 35, you should be checking your prostate regularly. I have two questions. First of all, how regularly?
Okay, so if you check your PSA and it is normal, we advise that you have it checked every year.
Once a year.
Once
okay,
a year.
Good.
So depending on the level of your PSA, but however, if it is abnormal, then we see you more regularly, and that can be every 2 or every 3 months.
Okay, all right. Now, you mentioned family history, and immediately I remembered my own experiences when I've been filling forms and they've asked me questions like, do you have a family history of cancer? And I realized that I don't know. Now, I'm sure I'm not alone. I mean, what is your experience in the consulting room when you ask people about their family histories? Do people know how many of their ancestors and grandparents and parents and cousins and uncles have died of cancer? Do people know these things?
Kojo, you're right on. Most Ghanaians have very, very poor histories about their family's medical conditions. Even of their own medical condition, they perhaps do not have good histories of that, let alone to talk about their families. But I think we need to change that now. The narrative should change, and it should start from you and me. We are also in a country where we definitely give a good, befitting departure to our dead relatives. But for the families that lose anybody, please try and do your utmost best to ask at the hospital, please, what caused my father to pass away? What caused my mother to pass away? My brother, my sister? Because if it is a history of cancer, it's not even only cancers, but there are, as we have said, that some diseases run in families. And for the purposes of today being prostate cancer, if you get information that, oh, your dad passed away because of prostate cancer, your auntie passed away because of ovarian cancer, then it means for your family, it puts you at increased risk of developing prostate cancer if you are a man. Similarly, even other cancers if you are a female. So then you have this information, and with this information, then you can start to seek medical attention earlier. You can come for screening. Oh, doc, my dad passed away at age 62 years ago. It's taken me about 2 years now, but when I checked, they said he had prostate cancer. I'm afraid, is there something I should be worried about? That is spot on. Then we can start the screening early for you. So family histories. I know that we all have our histories, private and personal, but we can share this information with our immediate families, and this may be life-saving. It can help you detect some pathology with you way earlier before it has caused harm, and we can treat you and cure you potentially in this case. That is, eradicate the disease completely, rather than coming at a later stage and all we can do is manage. In Ghana, we are all managers. You just manage at that stage.
Yeah. You know, you mentioned earlier that there is a section of the population that are asymptomatic, so they will never show any symptoms until it's too late. But I want to know what symptoms there are for those who actually show symptoms. What are some of the things that might give a man an indication that he needs to, pay a bit of attention and check his prostate?
So some of the common symptoms are when a man wakes up frequently at night, maybe 2 or 3 times. He wakes up at night, he goes to pass urine, he comes back to sleep, he wakes up again and he goes to pass urine. Or passing urine during the day at a frequent interval. Or a man who strains to pass urine, because usually when you go to pass urine, you don't strain.
So if are you talking about if you feel pain, or if it's just difficult to get it out?
Yeah, if it is difficult to get it outside, and so that you strain for the urine to come out. Yeah, you strain to pass urine. Or when you pass urine after a short interval of less than 2 hours, you feel like passing urine again. Or if the urine stream is weak. These are some of the common symptoms.
So help me understand, what is the cancer doing in your body that is causing these symptoms?
So the prostate sits just below the bladder, and it surrounds the passage through which the urine passes, which is called the urethra. So once it blocks that passage, or once it grows bigger to reduce the volume of the bladder, once it blocks that passage, then you must use more force or pressure to push the urine out. And some of the symptoms that we see is that if you see blood in your urine,
right,
that is quite a late stage. So you don't want to get to that stage.
Yeah. How about the late night urination? How is the increased size of your prostate causing you to pee a lot in the night?
Yeah. So when the prostate enlarges, right, so that it grows into the bladder, it reduces the volume of the bladder. So instead of the bladder filling to a volume of about half a liter, the small amount of urine in the bladder will irritate it, so that you pass urine at a frequent interval.
Interesting. Listen,
let me also add briefly that one of the other common symptoms, although a bit late, is low back pain, severe back pain. And this tends to be something that in the general population we say, when a man complains of back pain, especially it's a little advanced in age, daddy, it is osteoarthritis, it's old age. No, not all back pain is from osteoarthritis or growing old. Back pain at the level of your waist, commonly, because that is the commonest place prostate cancer, when it begins to spread, will go to your bones, mostly at the back of your waist area. So when you have low back pain, it may already be a late sign or disease if it is indeed prostate cancer. But you should come and check quickly, so that we can check to be sure that it's not prostate cancer. If it's not prostate cancer, we can always find out what it is and then direct you to the appropriate specialist to treat that.
Okay. Let me add that when you have the low back pain, when you have the low back pain, when it progresses, it gets to a level where you cannot walk.
Wow.
Yes, you become paralyzed. Yes, because the disease affects the bone and it affects the level where the nerves pass to give strength to the the lower leg. Yes.
Wow.
So,
well, these are things we need to be very, very aware of, very careful about, and I'm so glad you've raised them. We put up a tweet, a poll on Twitter. Okay, we asked a question to the men. We said they should choose one: death or erectile dysfunction. Of course, there are some people on Twitter who are not listening to the show, so they didn't understand the significance of the question. We're talking about prostate cancer on the show, okay? So tune in and listen. Very educated. But the question was asked: choose one, death or erectile dysfunction. I want to ask our guests, Dr. Awuku Asabreare and Dr. Wereh, to guess what percentage of men are saying they would rather die than have erectile dysfunction. There's a prize for who gets closest to the correct answer. Dr. Awuku Asabreare, what do you think the percentage is? Those who would rather die than have erectile dysfunction.
I think it should be about 70%.
70% of men would rather die than have erectile dysfunction. Okay. Dr. Wereh, what do you think?
I think maybe higher, maybe 80.
You don't have a lot of faith in these guys. Well, actually, I was surprised. 49% of men would rather die than have erectile dysfunction. 51% say they would rather have erectile dysfunction than die. So it's almost split dead in the middle. And it's only been up for 28 minutes. We've had about 187 votes. Okay. And this is the result. About half of them are saying there's still more time to go. It's an 1 hour poll, so we'll see how it ends. But almost half of men so far are saying they would rather be dead than have erectile dysfunction. Now, the reason why we asked is because it is a condition that is often associated with prostate cancer. Please educate us on the relationship between prostate cancer and erectile dysfunction.
Okay, so that's a very good question. So I must say that if the cancer is localized, so the cancer can be localized to the prostate. It can spread beyond the prostate, just beyond the, we call it locally advanced, or it can spread to a distant site. So if it's only in the prostate, then you can have the prostate removed by surgery, and the nerves that is required for erection is spared. So you have your normal erection. However, if it has spread beyond the prostate, then the aim of the treatment is to reduce the male hormone or the androgens, and that will inevitably lead to erectile dysfunction.
Wow!
As part of the treatment modality. So at that stage, I think your life is always more important, because there are other options that can be used to treat that erectile dysfunction that will come about because of the treatment.
Right. So actually, even if you report it late, and so as a result of the treatment you develop erectile dysfunction, there is also a treatment for erectile dysfunction.
Yeah, that's
right. What you're saying. Right. But do you find, Dr. Wereh, that a lot of men are afraid of this outcome, and for that reason it affects their health-seeking habits when it comes to checking for prostate cancer?
Yes, Kojo, very true. Men, and rightly so, we should be potent and should enjoy sex as much as possible. And to enjoy sex, you need a good erection. So that is not in doubt. And because of the nature of enjoyment of sex, most men find it very difficult to proceed or to further do anything that has the little or the remotest possibility of affecting their erections. And not only prostate cancers, but just prostate diseases in general. Another opportunity, we may talk about BPH, the other counterpart of the prostate diseases. We see a lot of men who come to the hospital, and just because of the fear that, oh doc, you're going to do something for me in my prostate, you want to put a catheter there, which they commonly call a rubber, you're going to pass an instrument there, permit me to use chi, it would work perfectly fine. You have no fears at all. It is just a tube we are passing there, or we are manipulating there, or the disease is there. But there is treatment for erectile dysfunction, and I want to just say briefly that prostate cancer is a very minute proportion or thing that contributes to erectile dysfunction. That is to say that there are other many causes of erectile dysfunction. Some may way common: diabetes, hypertension, high cholesterol, and things like that. Sickle cell disease, because we also have quite a sizable population. Erectile dysfunction is a small minority of it. If you do have erectile dysfunction or you have any challenges, the best person to see is a urologist who will treat that. But when it comes to prostate cancer, the cancer itself can cause it as a symptom, as my colleague said, when it's advanced. And our treatment also may cause it. Whichever one it is, we are armed to treat it. And we'll be with you all the way. So I want to encourage my colleague men, don't be afraid about erectile dysfunction at all. You come because your life is indeed more important. And I'm glad that perhaps we are wrong on the poll score.
Thank
at
God,
the moment.
right?
So it means that a lot more men indeed would take up that offer. And please come. Erectile dysfunction or not, we have to save your life.
Right. Okay. Now, just before we go, a member of my team has put a question through, and he wants to remain anonymous, so I won't tell you that his name rhymes with Shmemond. But this person wants to know, when they come to the hospital and it gets to the point where there is a need for a physical exam of the prostate, will it be a woman who examines the man, or can a man choose which gender does the examination? This is his question.
Well, I think mostly it is men who examine the men. We have some female urologists, so depending on his comfort level, he can. But mostly it is men who examine the men.
Yes. This particular team member might be a bit concerned about some upcoming laws in our country. Maybe that is what is making him ask this question.
And on a lighter note, in some parts of the world where there are lots of female and male urologists, the patient gets to choose. And even in the examination, although I described just one, there are various ways in which we can examine you. Some are standing, some are lying, some are sitting, whatever way you are. So in some places my senior consultants have been to, the patient comes in and we tell you, oh, Mr. Bright, which position do you want to be examined and who do you want to examine you? So of course, if I was the one, I'll pick my lovely lady, my wife, to examine me, hopefully. She's a urologist sometime.
Dr. Bright will taste. Okay. All right, listen, just before we go, maybe in the last 30 seconds, can you give some advice? You know, when it comes to breast cancer month, we always ask men to help women check for breast cancer and all that. It might not be as easy for women to help men check for prostate cancer, but are there other things that women can do to encourage men improve their health seeking habits and also to spot any early warning signs?
Yeah, I think when I tuned in this morning to your morning show, you asked this question to, was it Mami Esi?
Yes, Mami Esi, yes.
And I think she gave a very good response. The men need your support emotionally, physically, mentally. And so the significant man in your life, whether it's your husband, your father, your uncle, your mentor, whoever it is, you have to encourage the man to seek early medical treatment and early medical examination, so that whatever or wherever this stage the disease is, we can be able to diagnose and then treat or manage the condition.
Any signs, any things that a spouse or a sibling can look out for that might make them encourage a man to go and do
Yes,
some
any
testing?
change in the voiding pattern of the significant male in your life, any change, it doesn't matter whether it's nighttime or daytime, you see that the
What's
person
a voiding pattern? Sorry, what's that?
the way they urinate. So if you notice that they're urinating more frequently, they are taking longer at the washroom, they are having to strain, they notice they go to the washroom, afterwards you go and see blood in the toilet bowl. Whatever change you notice in the night, they are waking up more frequently, 3-4 times or more whilst you are still asleep. Honey, oh my dear, oh daddy, oh whosoever it is, I've noticed this change in the way you go to urinate. Can you go and have it checked?
I really appreciate that. In fact, I appreciate you both very much for starting us off with this conversation about prostate cancer. In Prostate Cancer Awareness Month, we're bound to have even more of these. But for now, thank you so much, Dr. Awuku Asabreare, Urologist Fellow at West Africa College of Surgeons, and Dr. Bright Wereh, who is a urology resident at Kolebu Teaching Hospital. Dr. Asabreare wanted to say something.
I just wanted to share one word. I believe that sometimes the disease gets to a stage where the patients cannot walk or they are in a wheelchair. So there was this common saying that when you come to Wajin and you have stroke, you can be able to walk, because the intervention is like that. When they come early, the condition is reversed. And it's like that somebody who is in a wheelchair will be able to walk. So this is what I want to end by
So that's
saying.
encouraging, right? That's encouraging for people to report early.
Exactly.
Because it increases your chances of recovery. Thank you for that very much. Dr. Awuku Asabreare and Dr. Bright Wereh were our guests for this conversation.